Today is, is one of those days in which all the witnesses are anonymous. Let me say something largely for the benefit of those who may at the moment be watching online. And it's this, that in the hearing room, you will see and hear the witnesses. There will not be any live stream visually of our first witness. He will be known as Paul. Then after the break, A.H., as he wishes to be known, will be known, will give evidence from outside the room. You will not see him, but you will hear his voice. Those who are remote from this hearing room will have neither. There will be no live streaming. There will be no live streaming either of our third witness, who will give evidence in front of you, but whose voice will not be simultaneously transmitted around the country. It doesn't mean that their evidence will simply disappear and not be recorded for the benefit of the public so that they can follow this inquiry. A transcript of the evidence that each gives will be provided later. So slightly different arrangements for each of the three. But we start, if we may, with Paul. And in his case, let me read out the restriction order. And bear in mind what I said at the start of the hearings, this set of hearings. It is so easy to think you've heard it all before and not to take notice. But it is important to each of the individuals concerned, as it is to all who have asked for and been granted anonymity. And it is important that they should feel as comfortable as they can be in giving evidence, which is, as those of you who've done it will know, those of you who've yet to do it will anticipate, it is not at all easy. So the order in his case reads as follows. I order that the name and address of Paul, the name of any other member of Paul's family, and any other identifying information, such as Paul's image or a description of his appearance, cannot be disclosed or published in any form unless express permission is given by me or by the solicitor to the inquiry acting on my behalf. Witness W1003. Numbers become quite important today because each has a number. Witness W1003 must be referred to only as Paul. This order remains in force for the duration of the inquiry and at all times thereafter, unless otherwise ordered. And I may vary or revoke the order by making a further order during the course of this inquiry. I needn't remind you, but anyone else who may be listening, breaking that order has serious consequences. Please don't go there. So, Paul.
Your name is known to the inquiry. Take a book in your raised hand and repeat after me. I swear by Almighty God.
I swear by Almighty God.
That the evidence I shall give.
That the evidence I shall give.
Shall be the truth.
Shall be the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the truth.
Paul, you have severe haemophilia A.
Yes.
And And during your childhood, you received cryoprecipitate, but you developed inhibitors. Can you just tell us a little about that?
Yeah, I was diagnosed with haemophilia after about a year, 18 months. I've got a haemophilia in the family. I was a genetic mutation, so I was the only one. I started cryo, I think, about 66, when I was 2 or 3 years old. And it was quite evident quite early on that I had inhibitors of resistance to it. So basically my body rejected the clotting factor that my body was missing in the first place. So treatment was given only for essential bleeds. And their thinking was that because of the inhibitors, they'd only give me cryo when I really needed it, because every time they gave it me, my inhibitor levels would raise. So it was treatment only when it was really necessary.
And for that reason, you were generally treated with bed rest, ice packs, splints, analgesia, and gentle physiotherapy for a large part of your childhood.
That was most of how my bleeds were treated, yeah.
And one of the points that's important to you, as I understand it, to make is when you needed treatment, it was not for life-threatening reasons, and this was not the life-saving treatment that you were receiving.
No, my whole life I've never had a life-threatening incident. I'm very lucky in that respect. I've never had appendicitis, a car accident or anything like that. All my bleeds have been in my joints, my knees, ankles, elbows. So all the factor I was given was just to stop the bleeding, to just basically stop joint damage. But I did have a lot of joint damage as a kid.
And from 1974 to 1976, and the significance of 1976 will become apparent in a moment, you didn't receive any cryoprecipitate at all. You were just treated in this rather more gentle and restful way that you've described.
That's right, I did. I went a whole 2 years without any treatments. It was just ice packs, cold water bandages, splints. Yeah, for that time period. In fact, there was one of my notes in my medical records. It says only dare to treat Paul in the event of a life-threatening bleed. So I didn't have any treatment at all for a few years.
Now, you produced a letter written by your father in March of 1975, and we're just going to look at that letter and what prompted it. Paul, it's 1003017, please. And it should come up on the screen in front of you. And you'll see it's addressed to Dr. French, who was your haematologist. It's dated the 2nd of March 1975. It says, "Dear Sir, I'm the father of Paul. Having observed the public interest lately in the blood extract factor 8, I find the article published in the Sunday Times, page 3, February the 16th, 1975, most disturbing. I've raised monies by charity organising in the past years for haemophilia research in the hope that one day haemophiliacs could be helped, if not 100%, even 50%. I'm writing to you after having thought deeply about this article to ask your, and then there's some words unclear, opinion regarding any personal help, if possible, for Paul. I would be willing to spend monies I have available to ensure a less painful way of life for him." So that's a letter your dad wrote.
Yeah.
And it was prompted by an article he read in the Sunday Times. And we've got that article. Paul, could we have the Sunday Times article up, please? Thank you. So we can see it's dated the 16th of February 1975. It talks about a particular child, not you, with haemophilia, and then goes on to discuss the question of factor 8 products. And if we pick it up in the left-hand column, Paul, please, towards the bottom of the page, it says this: "But little factor 8 has been made in Britain, partly because the Department of Health was unwilling to put up money for processing facilities, and partly because blood is scarce and a large quantity is needed to make a little extract. Other countries, however, have been making factor 8. It is available under the health schemes of many European countries. In 1973, the directors of British haemophilia centres, annoyed that many British patients were not benefiting from factor 8, began to put pressure on the Department of Health," and then it refers to 2 drug firms being licensed to import 10 million units of the extract from America and Austria, enough to treat all Britain's haemophiliacs for several months, but then refers to there being a snag in terms of the funding of that. And then if we pick it up, please, Paul, 3rd column, again towards the bottom of the column. Last year, the two drug firms struck with a large stock of Factor VIII with a limited shelf life started to re-export and protested strongly to the Department of Health. It responded last October by buying 500,000 units of Factor VIII from the companies and then offering it to the regional health authorities at the normal commercial price. What this was intended to achieve is uncertain, nor is it known whether all the material was bought up. A senior official at the Department of Health said it was certainly not purchased for the exclusive benefit of haemophiliacs. It may have been to promote goodwill towards the drug firms. And then it refers to the department having since licensed two other firms. And then there are two quotes from a Dr. Letsky at Great Ormond Street, which, Paul, you've drawn the inquiry's particular attention to. The first is this. Even the famous Great Ormond Street Hospital in London is so short of Factor VIII that it cannot give John, that's the child referred to in the article's mother, a few days' supply for use at home. John will undoubtedly be permanently crippled unless he gets home treatment with Factor VIII soon, says Dr. Elizabeth Letsky, who treats him. If we had sufficient Factor VIII, a bright boy like John could become a valuable member of society. But if he has to continue this way, coming in 5 or so times a week after an hour's journey, he's in danger of spending his life in a wheelchair and becoming a burden. Then there's reference to Lord Owen and a pledge of £500,000 to improve the blood transfusion services. And then in the right-hand column, we see this. At present, most national health haemophiliac patients are treated with a crude blood product called cryoprecipitate. And then it says this. This contains many impurities which make it dangerous, especially for children, Dr. Letsky says. Each time I inject a child who is allergic to cryo, I have a sinking feeling. I never know whether he will develop a serious reaction. There are no such problems with Factor VIII. That's the article that unsurprisingly prompted your dad to write to your doctor to say, is there something that can be done for my son?
I mean, as you know, I've only seen this article this week because the inquiry team was trying to locate it. It says cure. It says cure at the top in the headlines. I mean, any parent of anyone with haemophilia is going to attract their attention. If we've got a senior doctor saying there are no such problems with Factor VIII, it's going to obviously attract interest in using the product. I think as well, one of the most important things of this article that, it's obviously 75, so I'm looking back, the whole article is about if you don't have Factor VIII, it's crippling, wheelchair, and unfortunately being a burden on society. There's only a little comment from Dr. Ritzer that mentions life-saving. And as I say, for most people with haemophilia, most bleeds about crippling, or about joint damage, muscle wasting. Without Factor VIII, we would have undoubtedly, all of us probably ended up in a wheelchair and probably been a burden. But how many people actually have life-saving treatment with Factor VIII is probably quite minimal.
And just for the sake of completeness, we'll look briefly at Dr. French's reply to your dad. Paul, it's 1003003, please. And it says, it's dated the 6th of March, 75. Thank you for your letter about the question of Factor VIII concentrate. As you say, this is causing a good deal of public concern, which as a doctor who has to treat haemophiliacs, I welcome. The question is one of money, which as always is in limited supply, and of how best to use the money that is available. Very strong representations have been made in the medical press and elsewhere by doctors seeking to make Factor VIII concentrate more readily available for their patients. And then he goes on to talk about, in your case, the issue in relation to the inhibitors and only daring to use Factor VIII to treat you in the event of a severe, possibly dangerous hemorrhage. Yes. So that was the position in 1975. But the treatment you received changed in 1976. And we'll look at some letters in a moment. But can you tell us what was the change in 1976? How did you come to receive Factor products?
There was, I think, two instances, really. One of them was my parents attended the World Haemophilia Congress that took place in Britain that year. And Dr. Charles Ritzer was giving a talk on the use of Factor VIII, promoting the use of Factor VIII for patients with inhibitors. And obviously, having been told in the past I wasn't able to have these treatments, to have a senior doctor then say that they're now finding that there's benefit. Obviously, my mum and dad, I mean, I was 11 at the time, they were obviously didn't like to see me in pain, which I was obviously in a lot of pain at the time with bleeds that were being untreated. This was an option to move forward, we thought at the time. Dr. French made a referral to Oxford, and I do actually remember going down with mum and dad to see Dr. Ritzer, who basically sort of put forward a programme for me to start using Factor VIII as home treatment. I think it was recorded that I was only one of 4 patients in the country at the time with inhibitors on home treatment. So, yeah, it was what we thought was cutting edge, I suppose, at the time. I remember feeling very, very happy to be having something that was, helping my joint bleeds and not having so much time on the sofa or hospital.
And so your treatment switched to Factor VIII products. As far as you're aware, were your parents ever told of any risk of infection associated with the use of Factor products?
Not at all.
We'll just have a look at some of the correspondence. Paul, could we have up on screen, please, 10030007? So this is a letter of the 17th of June 1976. We've actually only got the first page here, but it's from Dr. Ritzer to Dr. French. Dr. Ritzer has seen you in his clinic. If we pick it up in the 3rd paragraph, please, it says, I see from your letter that Paul's not had a dose of Factor VIII since the 1st of January 1974. And then the next paragraph says this, I've had a long talk with, that's your parents, about the prospects of home therapy. They're both very keen for Paul to have it. Paul himself likes the idea. And then it says this, I think it would be wise to try as far as possible to treat him with the NHS concentrates. And I would suggest that you get in touch with Dr. Maycock, Lister Institute, to see if he can supply you. Failing that, get in touch with me again and I'll see what we can do from this end. As a last resort, I think it might be justified to put him onto one of the commercial Factor VIII concentrates, and I would suggest cryoblin, the material made by Immuno of Vienna. Now, there's a number of references in your records around this time in the correspondence to the fact that you should be treated with the NHS product and with a commercial product only being used as a last resort. Do you know why that was being said?
It doesn't say, does it? It doesn't say. No, I mean, looking back, I mean, there was nothing to say that because one is safer than the other. I just probably presumed it was about cost. Because all, like the article in the Sunday Times was all about cost and money. I do remember the doctors talking a lot about the cost of the treatment. That was always mentioned on the wards and in the clinics as a reason for not having and to use your Factor VIII responsibly because of the cost. It was always the cost, not the safety. So, yeah, I can see why now, looking back, but at the time, that wasn't obvious.
And we can just look at the letter that was then sent from your consultants to Dr. Maycock with the request, following on from Dr. Ritzer's suggestion. 10030006, please, Paul. 21st of June 1976. We can see it's Dr. Blecher, writing to Dr. Maycock at BPL in Elstree, saying this, the above lad's a haemophiliac patient of ours who's developed a Factor VIII inhibitor. In discussing his case with Dr. Ritzer recently, Dr. Ritzer mentioned that at Oxford nowadays they are treating such patients who have inhibitors with frequent and regular Factor VIII therapy and obtaining good results. He recommended that I place Paul on weekly prophylactic Factor VIII therapy. So there were 2 changes to your treatment regime at this time. Firstly, you were moving to use the Factor VIII products, but secondly, it was going to be given to you prophylactically.
Yeah, it was. But I think, actually, looking back at my records, there wasn't enough Factor consumed for it to be once a week, and I'd actually think it probably was more on demand, but yeah, it was suggested I go on it prophylactically.
And the letter continues, it would obviously be preferable to use the NHS concentrate. Again, as you say, it doesn't explain why that's seen as obviously preferable.
Yeah, obvious to who? Well, not to the patients or the parents, I think.
And then, lastly, in terms of the correspondence in June. Can we have up 10030005, please? And again, we see this is a letter from Dr. French. It's to whom it may concern. And if we look at the body of the letter, please, Paul, again, it refers to you having been seen by Dr. Ritzer, and then says, the factor VIII preparation preferred is NHS concentrate from the Lister Institute or that prepared at Oxford. Failing this, the commercial factor VIII concentrate might be used. And then we can see, please, Paul, at 10030004. This is a letter September 1976, again from Dr. French, and we can see from the last paragraph that by this time, September 76, your parents have been trained to give the doses of factor to you so that you receive treatment at home. One of the observations, or you have, I think, an observation to make about the use of home treatment as an idea, as a concept.
Well, yeah, I spent a lot of time off school and all the rest with bleeds that weren't treated. So actually having the treatment was better for, obviously I wasn't spending as much time in pain, but I was having more of a fruitful life, I suppose. But the thing is with home treatment, everything was talked about the cost. When the doctors were giving home treatment, the treatment was taking place in your own house, in the kitchen, whatever. If the doctors knew, obviously use NHS, not commercial, if they're saying things like that, if the doctors did know there was a risk, I think it was almost like they didn't have to see the risk. That risk was out of their vision. It was being done in my house. I don't know whether they would have felt differently if they were injecting it into my veins, if they knew it was risky. It was almost like, well, we're not seeing it, so we don't have to deal with it. And then the patients at home, myself, we weren't aware of any risks. I actually remember thinking it was great that I'd actually got things. Well, later on, I ended up on commercial products. We'll probably talk about that later. But yeah, it was great for us. But I don't think the doctor. I think there was a discord between the risk factors and what we knew at home, and because the doctors weren't seeing it, they didn't have that responsibility. That's only my thoughts.
Now, you've said in your statement you were treated prophylactically, as far as you know from your records, from the summer of 1976 to April of 1977, but after that you were treated on demand.
More or less, yeah. When
you had a bleed. By the end of 1976, despite what had been said in the letters that we've seen, and for whatever reason, you had started to receive the commercial factor VIII products rather than the NHS products.
Yeah, and I don't well know why that was, whether that was a financial thing. But we go from letters in June and doctors' notes in June saying, NHS Elstree products, at the last resort, commercial products. And that was documented in September 76. But by December 76, I was on American commercial products. Well, only a 3-month difference. So we've gone from one extreme to the other, really.
And we've got a list of the products that you had from 1980 onwards in your witness statement, and we'll just call up that list, please. Paul, could we have Paul's witness statement up, please? And we'll go to the second page. And we can just see here this list. It gives us a sense of it. From 1980 onwards, you've got Coate, Cryobulin, Humanate. There's then in 81 the NHS product being given. Then Factor VIII, Coate again, Cryobulin, Factor VIII. In 1982, you're recorded as having haemophil and so on. And we can see from that the majority of the products that you received during that period were the commercial products, with you only occasionally receiving the NHS product. Yeah. And was there ever, as far as you know, any discussion with your parents about that change or any reasons for it?
No, only financial. I think it was probably some products were cheaper for the hospital to buy in. There was I mean, something significant changed in 1977, but before this, but no, it was anything and everything. I remember having porcine factors at one point, but my factor records were a bit sketchy, really, from what I've received from the UK HCDO and my files.
Now, it was in April of 1977 you developed acute hepatitis B. What can you recall about that?
Well, having had my first commercial factor VIIIs in December, which I think was the Cutter product is mentioned in my notes. By April 77, I had Hep B. I had a lot of nosebleeds. I was losing weight. I was jaundiced in colour, and they diagnosed me as having hepatitis B. I was told I was very unlucky. Within 4 months of having my first commercial factors, I'd got a strain of hepatitis. I remember it being a very strange time because I was aware with haemophilia at that age. It was all I'd known from growing up. But this was something different. It sort of changed things a little bit for me inside, and I think the family as well, because they treated it like it was something serious. The whole family, my mum and dad, my brother and sister, they were all blood tested to see if they got it. I remember having to have separate towels, face washing cloths, mugs, knives and forks. I was treated separately from a point of hygiene, really, and I was aware that something was dangerous with the blood. I had the hepatitis B in the acute form, not the chronic, so I actually displayed all the symptoms very readily and was ill for a couple of months. I was young, I was 13 at the time. I bounced back from it. I thought I'd been unlucky. I was told I was unlucky. And that was my experience of hepatitis. Yeah, you go yellow, you don't eat your food. I lost weight. I couldn't eat anything fried for a long time. I think one of my doctor's notes says keep Paul on a bland diet. And that was more or less it, really.
In terms of risk, you were, as you say, simply told, your family was told you'd just been unlucky.
Yeah. Well, if there was anything more serious, I suppose that was negated by the fact that they continued putting me on the same factor products that I was using before having Hep B. So it didn't stop my treatment. I still continued to use commercial products after that because I'd just been unlucky that time.
We can see from your records, I won't call them up on screen, but you've referred to them in your witness statement, and we have them, that not only was your family tested and you were given advice about having separate utensils and so on, but that also action was taken by your doctors to write to the manufacturers of the products that you'd been receiving to report a possible problematic batch.
Yeah.
And you've contrasted your experience in relation to what happened when you had acute hepatitis B with what happened 8 years later when you learnt of a further infection.
Yes.
We'll come on to that. But you recovered in any event after a few months from the acute hepatitis B.
Yeah.
And then you have recalled in your witness statement in around 1983, 1984, becoming aware, or your family becoming aware of the issue of AIDS, and you refer to a World in Action programme.
Yeah, I think that was the first time we were alerted. I mean, because I'd had the Hep B, I was aware, and our family was aware, there was a risk of something, but as I say, that risk of the hepatitis was me being ill for a couple of months. Well, if that's the most dangerous thing, then if the factor VIII is actually reducing my pain, helping mobility, helping me have more of a normal childhood, then I think you sort of weigh those risks up, don't you? And when the World in Action came out, obviously it alerted us. My mum and dad were members of the local haemophilia group. I think they'd had a phone call to say something's on the telly, and we watched it. I remember watching that. And at my next appointment at the doctor's, I think they played it down. I remember them playing it down. I remember them saying it was sensationalised and all that, you know, oh, that's not going to be happening in England and Britain. It was a sensationalised television programme. The doctors seemed quite happy to keep prescribing me the factor VIII. So, you know, we did have, like a lot of people have sat in this chair, trust in doctors. I mean, because of the nature of haemophilia, you were a patient your whole life. It wasn't a one-off. So you had a relationship with your doctors. They were like, you know, you saw more of them than you did members of your own family. So, yeah, there was trust there. So when the doctors were, the television programme's so sensationalised, don't worry about it, carry on taking the factor. Yeah, we did.
And you've said that the other source of information for your parents, as well as the doctors who responded in the way you've described, was the Haemophilia Society. And you've referred in your statement to some specific leaflets that were disseminated by the Haemophilia Society at the time. And
yeah, the Haemophiles.
Yeah, and you've quoted from a couple of them, but we've got the actual leaflets. So we'll just have those on screen. Paul, could we have 100318? We can see here the date of it. This is Haemofact AIDS release number 3. It's dated the 11th of May, 1984. And if we go over the page, just in the first and second paragraphs, it refers to, so it's described as acquired immunodeficiency syndrome and update. The occurrence of acquired immunodeficiency syndrome AIDS in haemophiliac patients has strongly suggested transmission of this disorder by blood products, and epidemiological studies have suggested it may be related to a transmissible agent, and some further information given about the work being undertaken in America and in Paris. It says these reports should be received with optimism. Obvious benefits from such findings would be the provision of a blood test for both affected persons and donated blood, and in the long term, the development of a vaccine. In Great Britain, the number of haemophiliacs who've been reported with AIDS remain at 2, thus the incidence is less than 1 in 1,000 patients at risk. And then there are a number of other observations, and if we just go over the page, please, we can see the author of this, it would seem, is C.A. Lee, Senior Registrar at the Royal Free, Dr. Christine Lee. That's the first leaflet you've referred to in your statement. We'll just look at the second and then come back to your evidence about it. So, Paul, could we have up on screen, please, 1003-019? So this is the subsequent release number 4, Haemofact AIDS, 24th of September 1984. And then over the page, we can see this is authored by Dr. or Professor Kernoff, again from the Royal Free. The possibility that the acquired immunodeficiency syndrome AIDS may be caused by an unusual virus has always been a strong one. And then again, it refers to the work being undertaken in France and the USA to isolate the viruses. That's described in the next paragraph as a major step forward. It suggests that tests may take some while to be developed. And then towards the bottom of the page, last 5 lines, it says this: the presence of antibodies implies past exposure to LAV/HTLV3, but this in itself isn't too surprising. Most haemophiliacs have antibodies to a variety of different viruses in their blood, probably as a result of repeated exposure to small amounts of these viruses in transfused blood products. The presence of antibodies, at the top of the next page, thanks Paul, is usually taken as evidence of immunity to infection, and perhaps one reason why the risk of AIDS in haemophilia is so low, around 1 in 1,000, is that many patients are immune to it. And then it goes on to say there are probably other reasons too. And then there's a reference in the next paragraph to AIDS being a relatively new problem for haemophiliacs, but infection with hepatitis B virus being an old one, which is fast on its way to being solved. And then we've got, for the sake of completeness, as part of the documentation from you, the follow-up leaflet, but I don't think we need to go to that for present purposes. What you've said in your statement about these leaflets is that they provided a further degree of reassurance to your family because they essentially gave the impression that the risk was a very low one. Is that correct?
Oh, yeah. I mean, it's in black and white there. I mean, Mum and Dad got a lot of information from the Haemophilia Society. They were active members within the Haemophilia Society. these are the information leaflets. I didn't actually see these just some years ago. My mum had actually kept them. They was what they... I think she kept them because after they realised that I'd been infected with HIV, that it was something like tangible to hang on to sort of say, well, we weren't making a mistake. We were trusting the doctors. Not only were they trusting the doctors we saw in person that were still administering the Factor VIII and sending it to my house for us to use at home, but the information that was coming from the Haemophilia Society, which was and has been the only really information source and support for people with haemophilia. In two separate articles, they're saying the risk is 1 in 1,000. They're saying the incidence is low. They're saying that we might have had antibodies that will actually protect us. It's quite upbeat. Well, it's bad enough if 1 in 1,000 get infected with HIV, but it was almost like if that's the only risk we've got is 1 in 1,000, people probably took that risk because they didn't really know the implications of HIV at the time, and nobody was saying don't use it. They were saying continue. I mean, there is another article that we've not discussed. Was at the same time there was Peter Jones had got the booklet AIDS and the Blood, and there was a question, and that was about should I stop my factor treatment? And he said no. I think it said something along the lines of there would be more damage done from not treating bleeds than there ever would be from any possible risk of HIV transmission. We went from a guess, and I'll say guess, whether they worked that out, I don't know, but from 1 in 1,000, it actually turned out to be about 33%, a good third of us ended up with a whole...
What you've said in your statement, with this information from doctors and from the patient organisation, and of course the Haemophilia Society leaflets that we've just looked at, what they're based upon is advice from, it would seem, the doctors they're named. Says no one was saying anything different, we accepted the risk was minimal. And then you say this, my doctors were still advising continued use of factor concentrates, even advising me to take factor more regularly on the same day that I was unknowingly tested for HTLV3. Can you just expand upon that last point, please?
Yeah, this is something when I got my medical records back that I really did look through with a more of a inquisitive eye, I suppose, really. I had I remember it was the 19th of April, I remember from reading my notes, 1985, that my notes in the doctor's records from the actual appointment, as a normal clinic check-up appointment, I'm still having lots of internal bleeds in my left knee. He's asking me basically to take Factor VIII on a more prophylactic basis and to undertake some gentle physio, or if I'm going to do anything physical, to take the Factor VIII prior to doing any physical exercise. So they're actually telling me to use more Factor VIII. And it's been said time and time again during this inquiry that from people with haemophilia that when you go for your clinic appointment, they take bloods. It's just part of the routine. And with me, they always check bloods for my inhibitor levels, and they check for platelets and full blood counts. What I didn't know that day was they were also testing me for HTLV3. There's no mention of it in my notes. It wasn't discussed with me. I didn't know they were testing for that. There was no mention of it.
And if we have up on screen, please, 1003.
Just before we go there, can I just take you back to the Haemofacts 3 and Haemofacts 4, 18 and 19. First of all, 18. Did it ever occur to you that Dr. Lee, in the first, might be using the word risk in a different sense in the way that Dr. Kernoff appears to have been using it in the second? If you look at the first, it's number 3. And it's the page before. And just pause there, in Great Britain, the number of haemophiliacs who've been reported with AIDS remain at 2. Thus, I'm not quite sure it follows, but thus the incidence is less than 100,000, 1 in 1,000 patients at risk. So she's talking there about incidence. if we look at the Kernoff letter, which is is number 4, thank you. Can we look at the
Second page.
second page, thank you.
Top of the next
And
page.
it's the bottom of one page and top of the other. The bottom of the screen, the presence of antibodies due to taking this evidence of immunity infection, perhaps one reason why the risk of AIDS and haemophilia is so low. So that's talking about the risk in haemophilia, whereas the first one's talking about the incidence. And incidence and risk might be thought of two separate things. So when Dr. Lee is talking about incidence, it's incidence of those who are at risk. In other words, every 1,000 people at risk to get full-blown AIDS. This is talking about the risk in a population. There may be two different things.
Yes, of course, you, Paul, I think were a teenager at the time.
You wouldn't have looked at it that way, I suspect. You just saw the two figures. But you took it that you had a very low risk.
Yeah, I think anybody else that was probably reading those information leaflets would have read it as the same. I mean,
I think we can explore this later.
Absolutely so. And certainly I think we have the potential to do so with at least one of the authors.
Yes.
no, I don't look at it like that.
Just picking up upon the reassurance that your family may have placed upon this, you found, I think, these leaflets in your mum's bedside drawer. She kept at least one of them, you've said in your statement, in her bedside drawer until the time of her death.
Yeah, my dad gave them me after my mum had passed away. She'd kept them all that time. I hadn't seen them until, it was 20 years ago now.
So returning to the 19th of April 1985, you went along for a clinic appointment. You were encouraged, as you say, and we don't have the record in the documents here, but the record absolutely says this, to use factor 8. And bloods were taken. As I understand your statement, you were not told that bloods were being taken that day for the purpose of testing for HTLV3.
No, there's nothing in the records. It's the sort of thing that I think you'd stick with you. No, I had no idea that's what they were doing.
And we'll just put up on screen the test result. It's very faint, but it's 10030014. The date taken, it's not very clear on this, but actually it is possible to see it on the underlying documents when we've looked at them, is 19th of April 85, as you've said. And then the test result says this: antibody to HTLV3 present. Now, I want to talk next with you about how you learnt of this test result. That was the 19th of April that the bloods were taken. You then received a letter in June, and we'll just look at the text of that, 10030015. 24th of June 1985, from Dr. Bletcher. It says this: Dear Paul, I've now received the results on all the tests we carried out on your recent blood samples, including one result I've only just received from a specialist laboratory in London. I should like to briefly discuss one or two of these results with you personally. Could you therefore please come to see me for a short time one day next week? Please telephone my secretary to arrange a time convenient to you and during my working hours. Now, you make some observations about that letter in your statement. Perhaps you could tell us what those are.
Well, for a very, there's only one paragraph, and yet it says an awful lot to me now. I mean, the specialist laboratory in London, I don't know where that was. I think that's quite an interesting thing in itself now, looking back. But he wanted to briefly discuss the results with me. And the appointment was only make an appointment for a short time. Didn't seem any urgency to it. Phoned my secretary to make an appointment. The fact that he briefly wants to discuss something with me, and he only wants to see me for a short time, to me, at the time, that said to me that wasn't very important. It was going to be something it was a brief chat. Why would you have a brief chat to tell somebody they got a terminal illness? It wasn't for my benefit. And I just yeah, I just think that was very, very poorly thought out. I was working at the time. I was 21 years old. I just basically asked my boss if I could have a short time off work. I'm going to go to the hospital. I've got an appointment. It'll only be an hour or two. I may well have even worked through my lunch hour or something to cover it, something that day. I can't remember, but I remember the afternoon very well when I went for that meeting, which was, I think early July, when I found out. So they took the bloods in April. They wrote to me at the end of June. I went for the appointment in July. I didn't actually see Dr. Bletcher who wrote that. I saw those two doctors.
Dr. French, you
Dr.
saw.
French, he saw me. He didn't make eye contact with me. Just looked up and down. It was all very strange because I was very used to going to the hospital, like all the other people with haemophilia, very used to going to the clinics. I went to the normal clinic and I was told it wasn't there today, it was somewhere else. And I was then told to sit outside. And I was on the ground floor in a corridor, which was the main thoroughfare. There was just one seat outside. It was a room I'd never been in. It was like a storage cupboard. I think the alarm bell's starting to ring a little bit at that time, but even then I didn't expect anything like that day. He wants to see me for a brief time, to discuss something. It's only going to take a short moment. I walked in the room. It was a windowless room. I just remember there being some filing cabinets, one desk with a chair one side where the doctor was sat and me on the other side. I remember him telling me they'd taken some tests for the HTLV3. I had antibodies to the HTLV3. I asked what the HTLV3 was. He said it's the virus that causes AIDS. I do remember him, my naivety at the time, saying, I've got antibodies to it. Does that mean I'm protected against it? And he said that the antibodies in this case meant that I'd actually got the virus present in my body. I remember him asking me if I'd got any questions. I hadn't got any questions because I was just like a rabbit in the spotlights then. If I'd been told in April I was having this test done, I would have had time to actually think about it. If when the letter came, it had given me a bit of indication. If it said, take the afternoon off, bring somebody with you, or whatever, I might have thought it a bit more serious. It seemed a very surreal moment that I was being told. I remember him saying to me, the only advice, I didn't have any questions. He told me I probably would, the HTLV3 virus would probably manifest to full-blown AIDS in, I think he said 2 to 4 years. Don't have sex. If you do, only wear a condom. It all seemed very strange because that was it. I was asked any questions. I didn't have any questions. Go. I remember even standing in the corridor thinking, did that really happen? I went back to my car and sat in the car park. I just sat in my car for a while, just thinking, did that really happen? Trying to run through what he said, trying to make sense of it all. Expecting something follow-up, and there was no follow-up. When I look back to when I was infected with hepatitis B in '77, which was 8 years earlier, I was told, family were given advice then, about the transmission possibilities. We were told about face cloths and towels and cutlery and all the rest, and I was given no advice with this at all. I wasn't given any advice. I'm sorry, it wasn't just don't have sex, wear a condom. It was don't have sex, wear a condom, and don't tell anybody. That was reiterated very strongly. Don't tell anybody. I went back to work that afternoon because I thought I'd be in trouble with the boss if I took any more time off, because I said I'd only be gone an hour or so. So I just pretended that everything was normal.
And you said in your statement you remember thinking it was odd that they didn't ask for your girlfriend at the time or your parents or siblings who you were living with to be tested. Again, contrasting that with what happened when you had the acute hepatitis B 8 years previously.
Yeah, It's okay. This is where my mind sets at the time. When I had Hep B, which I was ill with for 2 months, all the family were tested to see if I'd passed it to them. When I was given a HIV diagnosis, nobody was called in. So, in a way, that gave me a false sense of security that maybe it's not so bad, if it was really bad, or maybe it's not as bad as the hepatitis B was. It was very confusing, very confusing.
And you've described it in your statement as the briefest, most unprepared and most uninformed appointment.
Yeah, I had no preparation for it. They knew what they were going to tell me, but because they knew what they were going to tell me, I mean, looking back at it, they should have prepared me a lot. They should have known that telling someone, those doctors had treated me since I was a toddler. They'd known me, they know my family, they knew what I was like and everything. They just saw me for a few moments. Gave me the most devastating news I'd ever had. News telling me that I've only got a few years to live, telling me to keep it a secret. Everything went out the window that day. Everything changed that day.
And you were, as you say, 21 years old. You've said in your statement you had the world at my feet.
Thought I did.
You had a good job, a girlfriend, an active social life. But on that day, your life changed forever.
Yeah.
But you still thought you were one of the unlucky ones. You were the 1 in 1,000.
Oh, yes. That was the other thing. I didn't realise how deep this was. I mean, because they'd called me in and I'd been given this and I was told not to tell anybody. I was unlucky to have the Hep B. I thought I was unlucky to have the HIV. Because of all the literature was saying 1 at 1,000 in risk, I just thought I'd been really unlucky. That was all. I just thought, well, life is life and some people are luckier than others, and I just thought, I was just drawing the short straw every time. And that's what probably quite selfishly, I thought I was just, one of the unlucky ones. If there had to be 1 in 1,000, I was the one.
Did you receive, following that appointment, which you've described in the way you have, did you receive any follow-up care, any follow-up appointments at the hospital in relation to the HIV diagnosis?
Not initially, no. I still went for the normal haemophilia clinics, which I think at the time were every 6 months, which was probably quite normal. But no, I didn't have anything. There's nothing in my notes and there's nothing in my memory that say I had anything up until about 87, which was about 2 years later. I was referred then to I suppose one of the very early HIV clinics. It was in the same hospital, and it consisted of seeing 2 doctors. One was a chest expert, because most of the people with HIV who were developing AIDS at the time had a lot of pneumonia, a lot of chest complaints was probably the most common, and a doctor from the sexual health clinic, a GUM doctor. And I saw them. It was good. They talked to me differently. They treated me differently. They gave me a bit more time to talk about things. But I just basically bottled that up for 2 years. I saw a counsellor there as well. But at that clinic, everything was different, because it was the first clinic I'd been to that was, I think I was the only guy with haemophilia there. It was fairly obvious, to me at the time anyway, that most of the people there were gay guys. And all the guys with haemophilia were all tested. Children, adults, we were all tested in around 85 without our consent. They didn't test all the gay guys in the country without their consent. People were getting ill. So in many ways, I think a lot of the gay guys were getting iller probably before those that were knowingly they had HIV were actually exhibiting illnesses, and then got tested and then came to the clinics. So I was seeing people for the very first time that were actually ill, and that was definitely a changing moment for the psyche in me. That this is real. This is what I've got. I'm going to end up looking like some of these people in this waiting room. yeah, it was a big dawning for me, that was.
And you've... Carry
You
on.
know, they had a counsellor there that was part of the team. I remember seeing her. Oh, she was a lovely woman, but I just remember her telling me how brave I was. I didn't come away with anything constructive to use, or I didn't allay any of my fears. Yeah, but I did feel like somebody was taking that part of my illness a little bit more seriously. I'd lost my faith in the haematologist at this point as well, because the haematologists were putting in the print risks of 1 in 1,000. My haematologists at the hospital were continuing to prescribe me factor VIII. Risks weren't really being given. And then I ended up with the HIV virus. So I didn't really trust them. I started to mistrust my doctors at that time. And
the impression that your statement gives is that a lot of the information and practical advice and guidance that you've obtained since that time has been not from the medical profession, but from the gay guys and the drug users and the organisations that were set up to support them, rather than from the NHS bodies. Is that right?
Yeah, the Haemophilia Society had been mine and my family's source of information about haemophilia. This was different. I said, where did you go? And so for information about HIV, and well, yeah, the organisations that mainly supported gay people gave the information about HIV. So, yeah, I think one of my first phone calls was either to Terence Higgins Trust or Body Positive. They didn't have a lot of people with haemophilia phoning them, and this was obvious from the switchboard, the people that answered. So there were different questions, but I felt that there was some support there. And I then started going to HIV clinics, in which I'd befriend people with HIV that were gay guys, not haemophiliacs. So yeah, my support avenues changed quite a bit. With drug users as well, that probably came a little bit later when I was stepping ahead, but I know you'll come back to this with my Hep C diagnosis, because at the time it was the gay guys with the HIV and the drug users with the hepatitis, and people with haemophilia, we had both. And you'd phone one organisation or get support for your HIV, but they didn't really know a lot about Hep C at the time. And you go to the Hep C organisations, people like Mainliners, the British Liver Trust, they weren't all that geared up for HIV because their specialism was hepatitis C. So, yeah, it was a bit of a runaround. So, meeting other patients with HIV and hepatitis C was great for me because, yeah, that peer support whether they had haemophilia or not, if they had HIV and hepatitis C, we had something in common.
I just want to ask you a little about how the diagnosis of the HIV infection affected you in those first years, both mentally and physically. We start with the mental impact. You talk in your statement about believing you were going to die and being very, very scared.
Oh, yeah. Yeah, it was... The stigma was intense from all avenues. I think the best advice my doctor ever gave me was don't tell anybody. Yeah, you couldn't tell people. People's attitudes to HIV were vile. This inquiry's seen a lot of people's experiences. I'm glad to say I didn't really have any horrible experiences, and the only reason I didn't was because I kept it so secret. My family kept it secret, I kept it secret. That day, from that moment onwards, I got very good at lying.
You told people you were one of the lucky ones, that you didn't have it.
Yeah. Our families, we knew other people with haemophilia. You know, my mum and dad knew other people and other parents, and, you know, you'd probably bump into someone. How's your Paul? Oh, our Paul's okay. He was a lucky one. You know, people had asked me, oh, have you had this AIDS test thing then? Yeah, I'm fine, I'm lucky. Yeah, I used to just brush it off if people asked. I stopped telling people I'd got haemophilia in case they asked. Yeah, things changed a lot. I was very, very aware of my mortality. Yeah, I didn't sleep very well after then. Everything changed. My job went downhill, my performance at work, I wasn't sleeping at night. I'd keep it together all day long, trying to keep a lid on things, trying to keep a lid on my emotions, petrified that people would find out. Yeah.
You put it this way in your statement, Paul. The thought of dying never left me. I closed my bedroom door at night and my world collapsed. I was very fragile inside by now and would break down. I cried a lot at first, always alone and always when I knew it was safe to do so. I had been given this virus and I hadn't been given any tools to know how to deal with it. I kept it to myself and it stewed and rotted me away from inside.
Yeah, that's about right. And I think that's, the doctors knew I'd got this. I hadn't been given any mechanisms to actually work it out, apart from me. I had to work it out myself. I just felt so lonely with it all.
You talk in your statement about it being about 5 years later, you were introduced to a psychologist who you felt comfortable with and you started talking about your fears. And she set up a self-help group for infected people with haemophilia in your area. What can you tell us about that?
Yeah, this was a very illuminating time and a very, very sad time too. I mean, I'd had 5 years with the diagnosis at that point, the HIV diagnosis. At that time, I didn't find out I'd got Hep C till later, but the doctors changed at the hospital. The two doctors that have been treating me, that have been mentioned so far, had both left. We had a new consultant in, haemophilia consultant. He called a new clinic. It was like a review clinic, which I thought was great. A new doctor, new start. That clinic, what was very different about that first clinic was the people in the waiting room. There were people I hadn't seen for years. Because having haemophilia as a kid, when there wasn't the treatments around, and when I'd got my inhibitors, I'd always end up in hospital. I mean, Mum and Dad were members of the local group. I knew quite a lot of people with haemophilia in my area. And I hadn't seen a lot of them for a long time. I never really questioned it, really. But I saw a lot that day. At least 4 or 5 of them that I'd known from childhood, from hospital stays in childhood. And it was a bit like a little reunion. It was sort of penny drops. A lot of them didn't look very, very well. And I think the consultant had called a meeting for all the people with haemophilia on his books that were HIV positive. That was the moment I'd actually realised that, hang on, it wasn't 1 in 1,000. I didn't actually realise so many people had been infected. I didn't realise how many people that I'd actually knew had been infected. It was, a bit of a door opening, a light shining that day. But that consultant, who's still around today, he also invited to say he was aware that none of us on our records had seen anybody professionally to talk about anything. And he had set up a psychologist, and at that appointment, as I remember it, there was an opportunity to see a psychologist. So I saw the doctor, first time I'd seen him, had a review, all the normal stuff, how far can you bend your knee, how far can you bend your elbow, and feeling around my lymph glands and things. And yeah, I'd had a few issues at that time as well, HIV related, with lymph node problems and coughs and colds that wouldn't go away. But yeah, I saw this psychologist. She was great. It was the best help I'd had from anybody at that point. It was the first time I'd actually had to talk about it. She was aware that none of us had actually spoke to anybody else about it, so she set this little support group up. There's probably 10 or 11 of us, probably all the adult people with haemophilia in the area that were HIV positive. 4 or 5 of them I'd known from childhood. It was great at first. It was like we all had an opportunity to talk. We met once a month. It was a basement room at the hospital. Again, no windows, shut door, no sign on the door. We felt safe in there. Yeah, and everybody talked about the problems. Everybody talked about their issues. It was incredibly sad. People's stories. However, I don't think I'd be here today if it wasn't for those people, because probably in a selfish way, I developed those tools of survival by their problems. A number of them had started AZT. It was all the guys that was on AZT that looked the illest. Whether it was they became ill first and then had AZT, but we used to sit in those meetings. It was the guys that were on treatment that were the ones that didn't stop scratching their sores, and the ones that were being, just showing symptoms of being poorly. And we all talked about our illnesses. There's bits about secrecy. There were guys there that were older than me that had kids. Some of them had told their work employees and the bosses. Everything changed that day, they said. They said they wished they'd never told the boss. People stopped talking to them. You know, one guy said that we used to have a canteen in the workplace and it was just mugs. The day after he told his boss he went to work, his desk had been moved and all the mugs had gone and paper cups had been brought in. So he said everybody in the office had known. Kids, the friends of his children were no longer allowed to come around and play. His kids were no longer invited to birthday parties. I realised really how important it was to keep this secret. I might have been at that point, having 5 years I've lived with it, at the cusp of wanting to tell people. But no, that reinforced the need for secrecy. It reinforced the need to be aware of the medications that were being offered. Because at the time, the doctors were trying to get me on AZT every time I went for an appointment. But it was mainly the haematologists. You know, I might have been to this. I only started going to the GU clinic, which was a sexual health clinic, for my HIV, quite sporadically at that time. It wasn't a regular. The haemophilia doctor was still taking most of my control over my viruses, and it never really sat well with me that he was his specialism was haemophilia, not HIV. Just because his haemophilia patients had developed HIV, he suddenly hadn't developed a specialism in HIV himself. So I wasn't a great patient as far as the doctors were concerned, because I questioned everything. I was very awkward as a patient, but that awkwardness is probably why I'm here today, probably one of the reasons.
And that group that you describe of patients, you talked about people being more ill every month, people getting thinner every month, and then the group getting smaller and smaller.
Yeah.
Because people were dying.
Yeah.
And you would be going to funerals.
Yeah. I knew some people said I won't be coming again. There's one guy in particular. He'd got the HIV, had crossed the blood-brain barrier. He'd started to, he was only in his 20s, and he was showing signs of a pensioner with Alzheimer's. He couldn't form his words, he couldn't speak properly, he was very frustrated, very confused. Yeah, it was very, very frightening seeing these illnesses and things. And the group got smaller. When the group got down to 2 or 3 of us, there was no real point in having a group, and that was over a 3-year period. And weirdly, it was the people that were on AZT that went the first. I think there was only one or two people alive after that early 90s period, as well as myself.
And you describe in your statement from those meetings and from watching people getting iller and dying, anger started to grow in you. And you started, amongst other things, and we'll come to a couple of examples later on in your evidence, but you started, amongst other things, writing to politicians.
Yeah, that was around the time, around about 1990, when I started going to those groups, when I realised so many people had been infected, when I realised, it was a lot of us that had got HIV. And those people that I knew, that did make me weirdly, I was more probably angry that people that I knew had been infected than I was myself in a way at the time. It was a very confusing time. My head was full of contradictions. Yeah, I thought I was going to die. I really did. But on the other hand, I thought, no, I'm going to beat this. You know, it's like a Jekyll and Hyde on different shoulders, and, you know, Sorry, Jenny, what was the question?
No, you've answered the question. You've absolutely answered the question. The
anger.
Yeah.
Yes, I did. I got very angry about it, and it did lead me to be asking questions, and fallouts with my doctors, and then well, somebody must be responsible. I must get more answers. I wrote to Margaret Thatcher. I mean, I wasn't really that interested in politics as a younger man. I was interested in music and normal things that teenagers and young men are interested in, and I certainly got interested in politics after that. I wrote to Margaret Thatcher quite naively, thinking she might be helpful. She didn't reply herself. It was from whoever she replies, a secretary or some civil servant, suggesting that this wasn't I haven't got a copy of the reply. There was a lot of letters I had in the early days that I lost. But she suggested that I write to my local MP, to bring this up with my local MP. Well, it just so happened at the time that my mum and dad lived in the constituency of Ken Clarke, and he was their local MP. So as Ken Clarke had been the health secretary and the Minister of State for Health during the 80s, I thought he'd be an ideal person to write to. So after writing to Margaret Thatcher, and I felt fobbed off, I wrote to Ken Clarke. And I actually was quite positive about that. I thought, he's the health minister, he'll know what he's talking about. He's also the local MP. I'll get a response. I did get a response.
We might as well look at that.
Let's have a look at that.
It's 021, please. Oh, thank you. It's already there, Paul. 22nd of January 1990. Thank you very much for your recent letter. I'm sorry you're so disappointed by the level of payment we're making to every person infected by HIV as a result of treatment for haemophilia. I do not accept that the infection was the result of any negligence on the part of anybody in the National Health Service, let alone the government as you claim. This tragic occurrence was the direct result of the emergence of HIV infection in the Western world, and haemophiliacs needed the best treatment that could be provided in the then state of medical science and knowledge, and that was what they received. If any of those affected are able to produce evidence to the contrary, obviously the courts will provide much larger sums by way of compensation. The government made available the money that we have, quite regardless of any question of legal liability. We did so as some expression of our sympathy for those who've been so terribly afflicted by these events. That was the letter you received in 1990.
Yes.
You have, in fact, written, or someone has written on your behalf more recently to Kenneth Clarke, MP. And we've got the response to a more recent letter. We can have the next document, please. Thank you. We can see it's dated the 19th of May 2017, and it says this: thank you for your recent email on the subject of haemophilia and the contaminated blood products. I do, of course, recall very clearly the tragedy of the infection of haemophiliacs that occurred in the early 1980s. The lives of many people were destroyed or seriously damaged, and every sensible person sympathises with them in their appalling position. I was one of 5 ministers at the DHSS at the time, but I was not the minister responsible for blood products, and I did not take any direct part in any of the decisions. He refers to a Daily Mail, a Mail on Sunday article, and says this: I think they're taking an answer that I gave to a written parliamentary question in the House of Commons. I did answer such questions because the minister responsible for blood products was a member of the House of Lords, and a Commons minister had to answer on his behalf in the chamber of the House of Commons. The answer that was quoted was based on the best medical and scientific evidence available to ministers at the time. I am sorry that people have come to believe that there was some sort of conspiracy and a criminal cover-up on this subject. Although not directly involved and with no expertise myself, I think that the haemophiliacs were the victims of the inadequacy of scientific and medical knowledge on the subject of AIDS in the first year or two when it first hit us as a scourge. No one would have authorised the continued use of contaminated factor 8 if scientific advice had been against it. There have already been 2 full inquiries into the subject which have taken and examined evidence. The most recent was a Scottish one. I think that the government is taking the view that another public inquiry would not be able to draw on any evidence that's not previously been examined. And then I think 6 weeks later, the public inquiry was announced.
Yeah, I had an inkling that the public inquiry was going to be happening. There was a lot of pressure building up, as we all know here. It had been coming. I wanted to get in there with Ken before. And the letter to Ken was to basically inform him that what the Mail in Sunday had said about him, and to ask about if he'd support a public inquiry, and that was his response. So yeah, although Ken didn't feel that a public inquiry was justified, I'm glad you did, Sir Brian. It's quite poignant that he wrote that just before the inquiry. I also think what's also quite poignant, we've got a 27-year gap between the 1990 letter and the 2017 letter, and he's almost sticking to the same line, that it was the best scientific and medical knowledge at the time, and no one would have authorised contaminated factor 8, which, as we know now, there was lots of evidence at the time.
Paul, can I take you back now to the early 1990s? We've talked about the mental, emotional, psychological effects of the diagnosis in those early years. You also, over the years, experienced a significant range of physical effects from the HIV infection. You had coughs, colds, lethargy, night sweats, rashes, and other infections. What was it like physically for you in those first years?
I think in the first few years it was more of a mental thing. I think it was just that fear. Well, obviously a fear of dying and getting very poorly, seeing other people with AIDS-related symptoms. None of them were pleasant. They were horrible, horrible diseases and disorders and illnesses. My overriding concern during all that time, which used to keep me awake, was the fear of infecting other people. That really, I think that was the hardest for me to get my head around. That I couldn't bear the thought of passing that on to somebody else. And I was always extremely careful with everything. I'd always, just in case I caught myself, and I'd always have a handkerchief in my pocket to wrap round a cut. I'd always have a pack of plasters on me in my pocket or my wallet or things like that. I was always very careful about my hygiene. Yeah, I couldn't tell anybody I was dangerous. I used to actually tell people, when I had my Hep C diagnosis, it actually became easier. And I don't want to downplay people who have only had Hep C, because that's been absolutely traumatic for them, and there's been horrible, horrible disease in itself. But I actually felt more comfortable telling people I had hepatitis, so I had to be careful of my blood. So if they didn't find out, I got HIV. So it was, that's where my head was at with that.
And you learnt of the hepatitis C diagnosis in 1992. How did that come about?
Again, routine clinic appointment, and yeah, it was. I mean, I was reading things about this by then. I was aware from previous conversations with doctors that there was, I'm talking about in the late 80s, that there was an issue about me having non-A, non-B hepatitis. So, yeah, I can't say that I was completely oblivious to the facts they'd come up with the next letter, C. So if there was going to give a name for something that was non-A and non-B, it was going to be called C. I thought that was, wasn't rocket science. Having had Hep B in the past, in its acute form, and been ill for a few months with it and bouncing back, I didn't really have that much importance put on hepatitis. So when I was told I'd got Hep C, and I did ask the doctor at the time what that meant, I was told, don't worry about the hepatitis C. The HIV will kill you a long time before the hepatitis C will cause you any problems. I was even told to have a drink if I wanted to. because I wasn't sleeping well with the HIV diagnosis, and I often, would have a drink to get myself off to sleep. I didn't drink heavily, but, you know, we need our crutches, and that was, one of my crutches, I suppose.
And then you received, at some later stage, a letter in relation to possible risk of VCJD, possible exposure to VCJD.
Yeah.
What can you recall about that and how that affected you?
Well, I was almost at the point I was give up at that point. You know, I'd had Hep B, I'd had HIV, I'd had hepatitis C. I was very, very lucky to still be alive with them all. And then I have a letter telling me I was possible got a risk of CJD. I mean, it'd all been all the news about the mad cow disease, and you were seeing how that was affecting people. I mean, I was angry at every point, but it was anger and despair thrown into one at that point, it was. The letter was basically asking me, like it was for an awful lot of other people with haemophilia here, you know, do you want to know if you've had a batch that's been directly implicated with a death of a donor that's been infected with, has your blood product come from somebody that's died of CJD? Of course I wanted to know. One of the most important things I took from the 1980s, the government's campaign of Don't Die of Ignorance, I changed that a little bit in my own psyche to Don't Die in Ignorance, and that's when I sort of set on a mission to know everything. Of course I wanted to know if I'd had a batch of CJD blood. I hadn't. It was a relief. My doctors said that I hadn't had any implicated batches. But the letter also said it didn't preclude that other people were going to also drop dead in the future of mad cow CJD, and that it had turned out that they were blood donors. So I was put on the CJD register in Edinburgh. I've never been told I've been taken off that register, so I'm presuming my name is still on there as in some kind of risk factor category.
In terms of treatment, first of all, for HIV, for the reasons you've already explained, having spoken to and observed people who were on AZT, you did not want to have AZT,
No.
and you resisted treatment for a number of years.
Yeah, and all the following drugs that came up. I mean, when I said I was in the self-help group that was set up, that was great. It was proper peer support, because that was people with haemophilia, with HIV. We had the same issues going on. Because a lot of them had passed away by the early 90s, and then I had my Hep C diagnosis by then. I'd also met and was familiar with a number of the gay guys that used to go to the GU clinics. The transition then was to go to one of the local HIV, well, there was one of it was the one HIV drop-in centre, and there was a social worker there. I went because they had a complementary therapy, so I used to have a back massage once a month. It was, I met a lot of people there from either the drug use past or gay people that had HIV. They became my support. I think there was only one other guy with haemophilia went there. But yeah, I had a lot of support from them. That was the opportunity on the coffee table. That's where all the magazines were, all the information about drugs and things. I had opportunity to talk to other people about what drugs they were on, what drugs were coming out. People were very open, and that's when I used to see all the I saw the side effects of the drugs, not those that were getting better. And the earlier drugs in the early 90s were very crude. A lot of them gave the lipodystrophy, lipoatrophy, which was like body fat changes. People's appearances were changing. It wasn't just what was going on inside, it was physical on the outside as well. It wasn't just people getting thinner and losing body fat. It was a lot more insidious than that. It was, but it gave me the tools to talk to doctors and in an informed way. I became involved in the 90s in a lot of other organisations, all really. I suppose I got involved with organisations like Mainliners that supported people with IV drug issues, and probably a lot of the I'd involved with things like National AIDS Manual, Community Advisory Board. They were organisations that were putting out information to the HIV community. It was empowering time for me because I felt I felt like a bit more of control. But I completely lost my trust in a lot of my doctors, and I'd obviously lost complete faith in the pharmaceutical industry. So to go on drugs that they've said have been trialled and they're great, you know, well, we've seen the 1975, the cure, that was no cure. I wasn't going to believe that something had dramatically changed in the way they marketed their products.
In more recent years, for HIV, you have been in receipt of combination therapy, although you've developed, or they've had to be changed over the years, not least because of interaction with hepatitis C.
Yes. I did start on... I have been very lucky to have lasted till my health got very bad at a time when the drugs got very good. And I'm talking about the late 90s, 97, 98 was when I had a CD4 count of about 5. The recommended treatment limit was 250. I think a normal, ordinary person's around between 800 and 1,000. I dropped down to 5. My viral load was just going through the roof, up to 1 million at the time. I couldn't stay awake for more than an hour or two. As soon as I shut my eyes, I just went straight to sleep. I used to sweat profusely within seconds. I had no energy. I had sores, all sorts of different complaints I had. And I was still at this point trying to keep a lid on it, keep a smile on my face and pretend to the world that nothing was wrong. Yeah, I thought my trying to deceive the public and my friends about my illness was getting a bit thin at that point. It was the time I started telling friends.
In terms of treatment for hepatitis C, that's been a less straightforward path in recent years for you. You didn't want to have interferon because you'd seen, as with AZT, you'd seen the effects of interferon on people that you knew and were talking to. Yeah, I saw... I had a very, very good relationship with my hepatologist. We spoke very frankly. He knew the drugs weren't great, but it's all he'd got to offer. We decided between us, which was a great way of dealing. I always felt it was a partnership working rather than a doctor telling me how to do things. I just had lots of regular monitoring. I had liver biopsies, ultrasound scans, and later in the day fibre scans to monitor my liver. I cut alcohol out as much as I could. I had a healthy diet. I tried to maintain my liver as strong as possible. I didn't want the interferon because I knew so many people that had tried it, and it was horrible for them, and it wasn't working as well. All the data that was coming out regarding co-infection, having Hep C and HIV, it was working even less well for people who were HIV positive. So it was, I know, to go through a year's long treatment that would make me very, very poorly for something that had less than a 20% chance of eradicating it, when I wasn't actually ill with it, and this comes back to the point, you know, I've been very fortunate. No, I didn't want it. And when the pegylated interferon came out, that was a bit better. And I actually thought, well, sounds a better chance with this. And I volunteered to go on a trial for that. I got very excited about starting the treatment because by then I'd realised that having co-infection had a comorbidity effect. People with HIV and hepatitis C were dying a lot faster because the two viruses together were in the body weren't a great mix. Taking HIV medication at that point, I was aware that all that HIV medication was being processed by my liver. My liver wasn't functioning as well because of the Hep C. In my mind, my longevity with HIV was to make sure my liver was working as well as it could. So, yeah, there's a lot of things in the mix at the time. And so what happened with the child?
Oh, I got to the week before I started to try it, and I was told I was refused to go on it because I had HIV. So I was refused that to go on that because they said the HIV would have been a contraindication to the trial data studies, which brings me back to a trust in pharmaceuticals that whenever they have a trial of any type, they choose the best cohort of patients for that trial. It's not, and then when the trial data comes out, the trial data is set with the best possible group of patients, and then it's used on everybody. So even if they're getting 60% success rates with the trial data, it is sort of obvious it's going to be 40% or less with everybody that they excluded from the trial. So, and again, I was seeing people who had started the pegylated interferon and ribavirin, and they were still having side effects, weren't really any less, and the bounce back. People have been cleared, and then the virus bouncing back. That psychologically affected people, and by this time, I know it probably seems quite fragmented, my story, but by this time, when I started going on HIV meds, I thought it was really important that I started touching base with the haemophilia HIV community again. I got very involved with the Birchgrove group, which was the self-help support group set up to support people with haemophilia. It was run by people like me. It was a very powerful part of my life at that point, because I did meet a lot of people that I did do over the years that were very, very good friends, people I had a lot of respect for. And again, a lot of those people aren't here anymore. But it was a fantastic tool for me to educate myself and to be able to educate others too.
And when, in more recent years, new types of treatment became available for hepatitis C, you wanted to receive that treatment, but what happened?
Yeah, I mean, I started hearing they were coming out. I heard they were in trial. I remember going to see my hepatologist, and yeah, first time I've seen him really with a beaming smile on his face. He, right, Paul, we've got these new drugs are coming on the market. You know, we're going to be getting them soon. You know, would you like to go on them? Yeah, great. I'd love to. And then nice guidelines precluded me from going on them because of the cost of the drugs. They were only offering them to people who had very bad decompensated livers. They were offering them to people that were on the liver transplant list. They weren't offering the drugs to people that were well or well-ish with hepatitis C. So I felt really, really angry at this point because they've got the NHS there. They gave me all the 3 viruses. They gave me the hepatitis C. They'd refused me going on trials. It got to a point where the drugs were on the market. They were licensed. My hepatologist is saying, this is like a completely new revolution in hepatitis C care and treatment. And the government body, NICE, was saying I wasn't eligible. So, yeah, my letter writing started again in... stepped up a gear, let's say that. I spoke to a lot of other guys with haemophilia, HIV, hepatitis C about this as well, and I wasn't making any headway with the hospital. So with help from some other friends out there who had also done their own bit of investigating, found there was a guy on Facebook in Australia that was selling it over the internet, and the clinic in India that was giving the Hep C treatment. It was the same treatment they'd got here, probably the generic drugs. I went back to my hepatologist and the care team and the gastroenterology department, and all I wanted to know from them was, if NICE won't finance my drugs, if I go to the clinic in India and have it done, which I was prepared to do that at my own expense, because again, with my fears of infecting anyone with HIV, my fears with infecting anybody with hepatitis C were probably greater, because hepatitis C is so much more infectious than HIV. I just wanted to get rid of that. I wanted to give myself a clean break with it, and I didn't want to be infectious anymore. All I wanted to know was, would the nurses in the hospital in my hometown do the monitoring, do the blood tests? I'll buy the drugs off of the internet, or I'll go and have 3 months in a clinic in India, but when I come back, or when I get them off the internet, would they do the blood tests? And they couldn't do that. Because they said all the blood tests and all the support were all costed into a cost of the treatment. So they couldn't do one without the other. So I basically said I would go down this line, but whether I got heavy-handed or not, I don't know, but I said I'd go to the media. I said, if I'm going to do this, if you're going to force me into taking this other route, I'm not going to do it quietly. Within a week, I've been offered the treatment. So, the Hep C nurse there and my heptologist were really pleased I'd taken that route, because it shook things up a bit. Within a year, I think NICE had changed their guidelines again, and a lot more people were being offered the drugs at that time.
And what was the result of the treatment, the outcome of it?
I've cleared my Hep C. It was the first line of the oral tablets. They worked very well. They were very potent. Right, I still got ribavirin in the mix. It wasn't a pleasant 3 months, and it wasn't a pleasant time after that. It did play havoc with me, I think. I just didn't sleep well. I probably got best at 2 or 3 hours sleep a night. I became very agitated, very angry. I sort of tried to keep myself out of the way of other people a lot. After the treatment, I was that intolerable of other people. I went and I lived in a caravan in a field with only a cold water tap and no electricity for 6 weeks, and I felt great about it. It shows that I didn't like people being. I was intolerant of people. Wasn't really like me, but it cleared the Hep C, and that felt great. And I had to wait another 3 months for the all clear, after the 3-month all clear, and it felt great. I'm still left with anxiety from it and a few other, residual issues, but not many. But it's great to get rid of the Hep C. It really was. It was a massive weight off my shoulders. For the basic reason I wasn't infectious anymore. It was one less thing to worry about. And it gave my liver a better chance of processing HIV meds, which I'll have to take for the rest of my life.
Can I ask you about the impact of everything you've described, the infections, the psychological strain, the treatments, on your private and family life and your ability to lead a normal family life? Your phrase in your statement is that you couldn't lead a normal family life.
No, I couldn't. I think anyone put in a situation, we've all been tested on that one. I mean, because I was so young, when I was diagnosed with HIV, my plans worked. Yeah, the expression I put in my statement, I had the world at my feet. I expected I'd get married one day. I wanted to have children. I thought being a dad was like a natural progression. It was something I wanted to do. All that went out the window. I mean, I don't know, finding a partner, having children, all those sort of things, they just fall out the window when you're told you haven't got long to live. The effect on my parents was huge, because they couldn't tell their friends. They couldn't tell anybody. They had to keep it secret. They had a massive range of emotions, but, I suppose guilt as well, because they fought for me to have the best treatments available. They read all the information, all saying, about playing the risks down. They thought they were doing the best for me, and then I end up with these viruses. So, the impact on them was huge. It's unnatural to lose your children before you. And there's a lot of people have given evidence in this inquiry so far that has been the case. And it's been horrific stories to hear. Nobody wants that. I never thought I'd have a relationship again. My relationship at the time didn't last very long after my diagnosis. I did meet a woman that became my partner, and later became my wife, and I felt at the time very, very, very lucky of that. I never expected to I just wrote off the idea of having a relationship, but we practiced safe sex constantly throughout our relationship. We never had children. It wasn't really an option. It wasn't an offer. There was a lot of issues around my illness that affected our relationship. My partner, she constantly lived with that I might die sometime. She joined a self-help group for the partners of those same guys that I was sat with. She was sat with their partners, wives, girlfriends, and as the guys I was sat with died one by one, the partners became bereaved partners. So the elements of that group changed from being supportive partners to their haemophilia partners. They were bereaved. Their issues were about bereavement. And my partner was the last one in that group that actually had a living partner. So, she was basically ostracised from that group because she no longer had anything in common with them. There was a lot of very, very dark times in our relationship that were all based around my illness. When I was very ill before I started my HIV meds, that was a very hard time for both of us. We both had to make a lot of decisions. It wasn't a natural relationship, a normal relationship, but with the normal issues. And I always thought I hadn't got long to live. So she always knew that I hadn't got long to live. So the emphasis you put on the normal things, the arguments or whatever, they change. You change the way you deal with things. It wasn't natural, a normal relationship.
And that relationship lasted a number of years, but then came to an end.
Yes, it did.
In terms of the effect of the infections diagnosis, the treatment, on your education and your employment, your ability to work, how has that been over the years?
Well, very sketchy. I mean, when I was a child, haemophilia was always going to be an issue. And because I said I didn't have factor for many years, I just used to have ice packs and bed rest. I was off school an awful lot. So the haemophilia played around with my schooling an awful lot. The social services were banging at the door when I'd had time off work, truant officer, just to make sure my parents weren't lying about my absences. They tried to get me to go to Lord Mayor Trelaw's at one point, the special school for boys with haemophilia, as we know. We know how special that was now. My mum and dad, I'm very, very glad to say, brought me up as normal as possible. They didn't want me going into a boarding school. They wanted me to have a normal relationship with my brother and sister, to play with the kids on the street, to go to the school down the road. And they fought very hard for that, even though there's a lot of pressure. I mean, I'm going off the viruses now. This is just a haemophilia story. But, I went to a special school for severely disabled children. I very rarely had any time off school there. I was very well looked after. I was picked up in a minibus. I actually remember quite enjoying it there in many ways. I went from my primary school at the time. I wasn't allowed to do sports. I wasn't allowed to play in the playground. I wasn't allowed to go on any trips. Like a lot of people with haemophilia, schooling was quite limited. And then when I went to the special school, I ended up being the fittest kid in the whole school. So I had a complete role reversal. I went, if they were playing football and you were picking teams, I was always the last one on the wall to be picked. I went to this school, I was the captain. It was, things had changed. But the headmaster got quite concerned because I wasn't learning anything. It was obvious he said I'd got a certain degree of intelligence. The school might have been good for my health, but it wasn't good for my intelligence. I was getting up to 11 then, and there was a lot of pressure. And again, my mum and dad put a lot of work into that. They got me into the local secondary school, comprehensive, and they took me on, even though I still had a lot of time off. Still wasn't allowed to go on field trips, play sports. Yeah, bizarrely, they wouldn't let me do woodwork or metalwork, but they let me do catering. So for some reason, the sharp knives weren't a problem as much as the the other tools were. There were some strange decisions taken about me that I wasn't included in the decisions, but I just went along with things. So, but no, with the viruses, with HIV, I worked in a bank. I stuck that for, I think, a year and a half, 2 years after my diagnosis. It was all part of my pretending everything was okay, trying to put a face on things. Let's be normal. I thought if I packed in my job, everyone's going to wonder why I packed in my job, and I just thought everyone's going to put two and two together. So I came up with a plan. If I packed in my job, I had to do something else. So I went back to Polytechnic, as it was at the time. Went back to, it was my first time I'd been to Polytechnic. I did a 4-year teaching course. I chose that course because it was 4 years. I didn't think I'd see the end of it. I thought it would give me an opportunity to have an excuse to be doing something constructive, but also to give me 2 or 3 months off every summer to go and see a bit of the world. I was still alive after the course, so I had a sort of natural progression to go into teaching. The career didn't last long. The first time I had a bleed, I had a bleed in my knee that wouldn't settle down. It was a bit unusual. It wasn't being controlled by the factor VIII. I ended up in hospital. The head came to see me in hospital, uninvited, stood by my bed, and asked me when I'd be back at work. I told her I couldn't tell her. Haemophilia didn't work that way. Could she explain this to the staff? And she said she was not mentioning haemophilia in her school. She didn't want, because if people knew I had haemophilia, they'd automatically assume I'd got AIDS, because everybody knew that people with haemophilia had AIDS. She didn't want her school reputation being tarnished. So she just more or less told me to get better as quick as I could. Well, I did come out of hospital and I handed my notice in. So
you put it this way in your statement, Paul. This was in 1994, and those words were from a school head teacher employed by the county council who operated under anti-discrimination procedures. I went home and handed in my notice.
Yeah, I did. I think a few people thought I was a bit mad for doing it, but the fact I'd had so much time off with my knee, again, it's all about these lies and secrets that you have all the time. You know, why did you pack in your teaching job? That was really good. Oh, because my knee's really playing me up and I really couldn't fit. It was too physical for me. It was a bad choice, you know. So, yeah, I always had an answer for things. It wasn't the truth. It was just an answer. It was just a, yeah. I actually quite liked that job as well, but, yeah. So I had a periods in and out of work, and I did a few different things. But yeah, the HIV had a massive impact on my my career opportunities. Anybody with haemophilia knows they've got some limitations on their career paths. You know, when I worked in a bank initially, it was great for me. I got a job for life. It was secure. It was sat down. It was doable from my haemophilia. I had the HIV. I knew I didn't want to go and work in a bank until I died. I didn't want to be putting a suit on every morning and working for some institution to keep them happy. You know, it changed everything. Being told you've not got long to live changes the way you think about life.
You've also described in your statement working for a number of years at the Citizens Advice Bureau.
Yeah.
You said this: I told most of my colleagues there about your diagnosis of HIV. It was a supportive atmosphere in many ways, but it was never straightforward. The boss was a gay man. He was very supportive of my health issues and the political dimension. The deputy manager told me that attitudes had changed, and if she was honest, she wouldn't have felt comfortable with me and HIV in her office 10 years ago. I had to tell her I had had the virus for 20 years at that time, and then you've added her husband was a vicar. So still in the 2000s, you were experiencing attitudes of discrimination and stigma.
There's still stigma around today. It's just not as severe as it used to be. And the only reason I put that in as an analogy was to sort of say, the passage of time, people think, oh, it's okay today, but I wouldn't. It's good that they're being honest. I mean, I can't think of a better organisation to work for, because the whole point of working for an advice bureau is you're giving people advice, and people who want advice mainly are very needy people. Everybody who worked there was very open-minded and very supportive. Yeah. It was a good place.
Can I ask about your experiences of the Macfarlane Trust?
Okay.
You've described a little in your statement. It helped a bit, but it felt like a a begging bowl? What do you recall of the application processes?
They were ridiculous, the application processes. They seem to change year on year anyway. They're depending, you'd have they'd say because of their budgets or their funding. But if you wanted anything, it had to be for their set of criteria. So, and their criteria would change from year to year, what they thought was, in the early 90s, they were giving lots of money away for, well, not giving it away, but you had to apply for it, for things like white goods. Lots of people had like night sweats, so things like bedding, mattresses, washing machines, they were fairly common. But if you wanted something that wasn't in their guidelines, it was difficult. But even if you wanted something in their guidelines, just because they knew you were on their books as such, you were registered to the trust, they knew these were the symptoms of HIV, you still had to get a letter from your doctor or your specialist clinical nurse. You then had to go and get quotes for bedding, quotes for a mattress, quotes. And it wasn't just one quote, you had to get 3 quotes. They're talking about somebody who's ill, having to run around, getting loads of quotes, going to the doctors. I'm sure that the nurses and the doctors had better things to do, like treat patients rather than be writing letters of support saying, yes, this person does have these illnesses and yes, they are experiencing these symptoms. And then when you submitted all the paperwork, you then had to wait for their next board meeting for them to sit around a table and decide whether they were giving it me or not. And most of the time, you never got 100%. They'd give you a percentage. It was hard work. It was almost like they'd made it as hard as possible. I felt, it was begging bowl. Bank of Mum and Dad were a lot easier, and I was fortunate to have that from time to time when things weren't good. But no, it wasn't you felt like you were begging. And because of that, I actually felt there was probably more needier people out there that needed the money. That was why they made it. They always seemed to reiterate about their reserves and how little they had. Every December, they'd send you a income and expenditure form that you had to complete. You had to send off evidence of what you paid on your council tax, what you paid on your water bills. It just seemed ridiculous to have to do that every year to show how much money you had left at the end of each month so they could assess how much money they'd give you. So, this was the only charitable money that the government said they were setting up as ex gratia support mechanisms. They were a support mechanism, and at times the money from the Macfarlane Trust was very, very helpful. But it wasn't an easy process.
You've told us about the extent to which some form of counselling, support from a psychologist, was something you were able to access a number of years after your diagnosis. What about your parents, whose feelings of responsibility and guilt and suffering you've described very eloquently? Were they ever offered any form of emotional support or counselling?
No, nobody was. None of my family. I was like going back to my Hep B days in 77. The whole family went to see the doctor because of that. The whole family were counselled about it, and there was nothing. There was nothing about the HIV, nothing about the hepatitis C. There was no counselling offered. I suppose if I'd made a case for it, it was be another application I would have had to make with the trust to see if the trust could. And they probably only like if you did have any counselling, it was only normally we'll give you 6 sessions. If you want any more, you've got to make a case to say whether you want any more or not. So no, they were offered nothing, no help, no psychological help, no support. No.
You've touched in your evidence already on issues of stigma, in particular how they affected you and the life of secrecy that you felt driven to live. You have, I think, some wider observations you wanted to make about the stigmatisation of the community of all people who had HIV.
Yeah, I do, because it's been mentioned so many times over the years, and it's been mentioned a lot during this inquiry about. It's very difficult to think, unless people in this room were there in the day and had the viruses. The stigma was really acute. It was vile. It was horrible, and it was from everywhere. There was no escape from it. It seemed there was nobody you could trust. Your best friends. There was nobody you could trust not to actually tell anybody else or not to have an attitude. It was like self-preservation to keep it quiet. But to me, The stigma was generated by the way we are in society, which is moulded by the media. I know the media are controlled to some degree by the government and by policies of the day. The newspapers, the television programmes, they mould people's attitudes. And it was people's attitudes that I feel were wrong. I always saw a common denominator with, well, the press, the tabloids. Started off so many stories. Gays, drug addicts, haemophiliacs. Only age story. They had those three groups in. I didn't see myself as any different from those other two groups. People don't have a choice whether they're gay or not. People don't have a choice whether they've got haemophilia or not. Drug users don't choose to be a drug user, to have an addiction to drugs. It's normally because of some trauma in their lives, because of, traumatic experiences that aren't picked up by the health, by their GPs, by their doctors. They were self-medicating. The gay society, because they were seen as the underdogs, it was like a separation from what is normal society and abnormal society. Having haemophilia, having a disability, you were put into that bracket too. I felt a kinship with the gay guys I met and the drug users that I met. That's where I got my support from, in the drop-ins. And it worked two ways as well, because a lot of the drug users and a lot of the gay guys that I got to know, they hadn't had the experience that I had, a childhood of being able to converse with doctors, going to hospital, going to clinics, understanding what your blood results meant. That they were part and parcel of having haemophilia. To a lot of the others, it was the first times they've actually come in front of any clinicians. So, yeah, I'd be helping them in like questions to ask your doctors. In fact, I did a workshop with a friend of mine who's been involved with this inquiry for one of the mainliners conferences, and the workshop we did was getting the most out of your doctor, understanding your test results, how to speak to your doctor, don't be fobbed off, be confident to question them, go in with a list of questions, don't leave that room until you've had all your questions answered. If they're using words you don't understand, ask them to explain them. It was that kind of thing. On that two-way street, those gay guys and those drug users with Hep C, with HIV, or with both, they were giving me experiences about their management of their conditions and what drugs they were taking to help their conditions and their experiences of interferon or whatever was going. I felt those two groups of people were very supportive to me. The press, their support organisations were part of the help that I had. It's the media that's at fault, the stigmatisation that all three of us had. Maybe so many gay guys wouldn't have had HIV if the education was put there and the support network was put there, if they felt comfortable to go to health clinics or doctors. But they weren't, they were stigmatised. With drug users, rather than blame the drug users, maybe they should have been blaming the health authorities for not recognising this earlier and giving them clean needles, clean syringes, support networks, advice about taking drugs. Would have been a lot more easier than blaming gay guys or blaming drug users for the spread of this infection, blaming haemophiliacs for this spread of infection. Because people with haemophilia did spread this unknowingly. And we've seen this time and time again during the inquiry where the doctors have known in some cases for years before they've even told the patients of the diagnosis. People have infected their partners, their wives. It was all unnecessary. It was as unnecessary in the haemophilia population as it was in the intravenous drug-taking population and the gay population. One thing that cemented all of this, as an example which we talked about, I think it was about 87, 88, or probably it might have even been earlier. I don't know, when you're brought up in life, you've seen the institutions that are there for you. The government, the police force, the church, whatever. They're the establishments of our society. Well, James Anderton was a guy that was a public figure. He was a chief police inspector of Greater Manchester Police. He stated in the press and in a BBC religious programme, he used the quote, "People with AIDS are swirling in the cesspool of their own making." That was a horrible thing to say. I don't know whether he was referring to people with haemophilia then, but to me it didn't matter who he was referring to. He was referring to people with AIDS who were swirling in their own cesspool of their own making. We've got a senior policeman who's also a Christian. It was on a religious radio programme, I think, or a religious TV programme this came out on. So to me, I've got the police and the church, both in hands, both saying this is the product of our own making. You know, we created this. It's like negating the responsibility from the government, from the Department of Health, from the people that were responsible. Margaret Thatcher, a few years later, knighted James Anderton. He became Sir James Anderton. So then politics comes into this again. The guy that said these things actually gets rewarded by the Prime Minister. Now, for somebody living with HIV at the time, this is someone that's just increasing that stigma. It's not someone that's a man in the street. It's not somebody that's ill-educated. So, yeah, those establishments that are there, we're brought up to look up to, yeah, I had lost my faith in so many institutions, at the same time increasing my anger towards these institutions at the same time.
Paul, those are the questions I have for you. Before I ask you if there's anything you want to add, I'm going to turn and ask Ms Monaghan if there's anything further she would like me to ask you.
God, thank you.
Paul, there aren't specific questions, but Ms Monaghan has reminded me, perhaps to remind you, that you, I think, in your closing observations may want to say something about pharmaceutical companies. But there are no further specific questions from me. If there's anything further you would like to add, this is your opportunity to do so.
Yeah, I just hope this inquiry... I do realise that most of the pharmaceutical companies involved in the infections are American. I can't, because of a legal case that happened in the States, it's very difficult, I think, my own observations, to bring those to book or to account or to actually have representatives of those pharmaceuticals sat in this chair next year. But what I would like to look at is the relationship the government, the Department of Health and the doctors had with those pharmaceutical companies. Because if this inquiry is going to change anything in the future, we've got to be looking at the relationship with the pharmaceuticals. Even going back to that press clipping where we started off today's talk from 1975, the Department of Health, or the DSS as it was called, Department of Health, had set up contracts with two companies, and it mentioned them as Travenol and Spadeworth products. It then goes on to say that the Department of Health was now setting up contracts with two other companies. It didn't say who. Questions I'd like to know is when the Department of Health or the government have contracts with pharmaceuticals, what measures are taken regarding safety of products? Because we've never had an inquiry into what happened to us, how do we know that things have actually changed? What is it profit driven? Is it just about budget? Is it about safety? What trial data? Do our governments or Department of Health scrutinise the trial data that the drug companies, the pharmaceuticals, say are the reasons for their use? I'd just like some more robust, to give confidence, not just to the haemophilia population, not just to the other people that have been at this inquiry that have been infected with Hep C through blood transfusions, but to everybody, every citizen, not of just its country, probably the world. When pharmaceuticals is such multi-billionaire businesses, the law firms of pharmaceuticals, the law arms, are huge themselves. There's a reason for that, is because they're constantly defending actions against where they've gone wrong. And we've seen it with all sorts of different thalidomide for reason there's been all sorts of illnesses and diseases. They're all have been going on. There doesn't seem to be an end to it. I just would like to see pharmaceuticals not get away with what they've got away with in the past. And I know a lot of people with long-term medical conditions wouldn't be living without those medicines, and I still wouldn't be alive today if it wasn't for the pharmaceutical companies that make such very good HIV drugs and manage to clear my Hep C. I'm not saying that they're the enemy, but it's the way they do their business which is wrong. Very, very wrong.
Is there anything else you'd like to say, Paul?
I'll probably think of something in half an hour or an hour. But I think I've held people's attention for enough, and yeah, I think I said enough.
Thank you, sir.
I would like to thank you, Sir Brian, there for bringing this inquiry. Yeah, I'd like to say, that anger you talked about, that anger that's brewed inside me, that went out the window the day this inquiry was announced. Because I felt very seriously for once that something was being done about it. I've got full faith in this inquiry, so thank you very much. Thank you.
Well, for my part, I think I might very much have enjoyed being a pupil in one of your classes when you were briefly a teacher. You put matters over so engagingly and persuasively. Thank you very much for that.
Okay, thank you.
We'll take a break now, and it'll be a lunch break, slightly earlier lunch break than usual. We'll come back at 1:05. 1:05.